The National Health Insurance Program, designed to provide health care for all BVI residents, is geared to provide financial support to meet the cost of treatment in times of illness and injuries. So what do people think about NHI? Do some people think there are gray areas in the plan that needs further clarification? Sean Rose has more.
The National Health Insurance Plan took effect September 1st with the beginning of the registration period, which runs until December 31st, and the plan actually takes effect January 1st, 2016. A number of people have been sharing their views about the plan, some positive and some people have various concerns. I have with me Suwanda Uhuru. You have registered some of your concerns with this plan. In a nutshell, tell us what they are.
The problem with the plan is because it makes contributions mandatory. Many people who are being currently insured through their jobs with private insurance will most likely lose that private insurance because the employers won't want to pay twice. It's going to have a lot of problems associated with it. People are going to lose their jobs who are currently working for private insurers. Private insurers most likely will put up the cost of other types of insurance.
But this is really speculation, you would agree, at this point?
Well, I mean, it's happened in other jurisdictions. The Turks and Caicos, when they did this similar thing or the same thing, other types of insurance went up to make up for the shortfall in health insurance. You think about small business. Whether small business can afford the deductions. They're already struggling making social security contributions. We can't take any more hikes in the cost of living here in the Virgin Islands. The cost of living is very high.
Your opinions are certainly valid. We're going to go to a different location, several locations around town, and hear from people what they think about this NHI plan.
I think it's a good plan for the BVI.
It's a good thing. It needs some fine-tuning, much fine-tuning.
What would you recommend to the folks to have it more fine-tuned?
It need to be more spelled out. People need to exactly know what's going on, how the money is going to be paid for spouse and children and all that.
I don't really know. I think it's all good.
So you've never heard anything about it?
Yeah, but...
You need more information?
Yeah, it's all good. And even if we disapprove or whatever, it done in the system, they will still go along with it. So our opinion don't matter.
How you feel about the NHI?
Good. Really good.
No good. You can't force the man to do what people do. I don't want it.
I have my insurance already, so I want to know if I have to pay the government insurance.
You can keep your existing insurance.
But that's two. So I'd have to pay the existing one plus the government one. That's too much money.
Well, to me, a waste of time. We ain't making no money, you know. We making no money. We make, especially me, I make $600 something every 2 weeks. And if you didn't take some money from my money, I can't get home no money.
The concept, I support. How it's going to work, I guess we have to wait and see.
Based on what I heard and based on the information I gather from myself, it's something where you don't have to reach deductibles in order to be covered. You don't have to wait for when a situation arises and you reach in the hospital. They have to be calling on the other end to find out if you're covered or if the other insurance company going to be able to pay for your health issue. But with the swipe of this card, the hospital will have all the information that they need about you, and help will be on the way, and you will be able to get the care that you need.
National insurance plan is good. I'm not going to say it's not good because, at least there are a lot of people really and truly don't have an insurance. But at the other hand, there's a lot of people who cannot afford to pay it because, for instance, there are people actually can, all they said, buy food or support their family.
So we've heard from a number of people from various walks of life in different professions talk about the NHI plan. In some cases, some people don't want to share their views on JTV for various reasons. So one day we started out with you. You're accepting as well that this plan does have some benefits.
Well, as you said, there's some benefits to the plan. Most people see the problem with it being mandatory. We don't wish for it to fail.
Minister responsible for Labour, Dr. Kedrick Pickering, he addressed critics of the NHI at the opening or the launch of the NHI on September 1st.
Some of the people who are anti-NHI and have been criticizing it talk about what their private health insurance can give them and where it can take them and what they can get. Well, let me say this to them and to all of you who would listen. God forbid if you have an accident. God forbid if something happens to you and you need emergency care. NHI takes care of you from the beginning to the end. And for those of you who are wondering even further, as you get older, when you no longer work in your retirement years, and even if you have the best private health insurance in the world, this is what happens. Your cost of insurance goes up, your benefits go down. That won't happen with the National Health Insurance Scheme. And that won't happen in the British Virgin Islands.
Well, thank you so much, Sowande, for sharing your views. And we've heard from many people, including Dr. Kedrick Pickering. Of course, there are other people who spoke there at the launch of the NHI on September 1st. We're going to see how this progresses. Certainly, there are issues that people want to have resolved. They want to hear more information in some cases. People want more explanation in other cases. Notwithstanding that, the National Health Insurance Plan takes effective September 1st, 2015. Sean Rose, JTV News.